So why do people get confused with Hashimoto's disease? It's not that difficult because the antithyroid peroxidase enzyme antibody that occurs in Hashimoto's disease can also occur in people with Graves' disease. What makes matters even more complicated is the fact that 10 to 20% of the population in fact have positive antithyroid peroxidase antibodies, and these patients are not necessarily people that will develop hypothyroidism. So what I'm referring to is a euthyroid, so a normal thyroid function with positive antibodies. If you have positive antibodies in the setting of a subclinical hypothyroidism, certainly then it indicates that one should check frequently because your risk of developing hypothyroidism in that context is high. It has also been shown that people, even though they are euthyroid, but if they've got high antithyroid peroxidase antibodies, can experience certain symptoms such as depression, tiredness, and so forth. And it has been proposed that these antibodies might have a direct effect on other organs, and therefore we often get the situation where someone is completely normal from a thyroid perspective, but they still persist with these symptoms compatible with hypothyroidism. So it's important that we know that the antithyroid peroxidase enzyme antibodies is an adjunct, and it is not the be-all and the end-all, but in the right context, it can certainly help to make a case for an autoimmune thyroid disease. It does help in certain contexts, such as women who undergo IVF. If they've got positive antibodies and they've got a TSH over 3, we will treat them. In people with a positive antithyroid peroxidase, even if they are euthyroid, we will increase surveillance, or we will be more vigilant for the development of hypothyroidism in them. In the setting of other autoimmune disease, or if you suspect that there's another disease such as Addison's, adrenal insufficiency, it is worthwhile to know that the Hashimoto's antibodies are positive, because that will sort of make you consider other autoimmune disease such as Addison's disease, for instance. It's not necessary to do Hashimoto's antibodies or antithyroid peroxidase antibodies to make the diagnosis of hypothyroidism, but it certainly sometimes in certain contexts it does help if you need to know the reason why.